Welcome to my little introduction about designing dental bite splints and night guards. My name is Wally Daskalaki, and here I will show you my setup until reaching the final design. A speed tutorial to get these results. Everything is dependent on a decent scan. I always also scan the aspired vertical dimension by using the multi-bite function of my scanner. After setting up the case, I start with defining the occlusal plane, like the rubber band for articulators. Thanks to my multi-bite scan, I don't need to open the vertical dimension anymore. Having our goal in mind, we now start designing. Similar to analog splints, undercuts are needed to snap it on. Our digital parallelometer lets us define those undercuts quite easily. Our next step is defining the margin, either in a festooned fashion or just plain straight. Overextension over undercuts is automatically blocked out and left hollow. Be sure to cover the full arc so you don't have elongations. Wisdom teeth are just partially covered to not disturb surrounding tissue. The more delicate the design there, the more comfort for our patients. It's better to make everything round and convex, everywhere. Afterwards, rotate the model and have a look at the approximal surfaces. Be sure to make the area of the breaking points more thick, so you can avoid fractures. Now let's go to the crucial design of adjusted occlusion. Anterior guidance for the protrusion and canine guidance for side shifting. A lot of programs let you define the posterior tooth area and give you it according design. This design suggestion has to be checked for static and dynamic occlusion. Be sure to use the sliders to check full dynamic occlusion. Now let's have a look on contact areas. This cloud-based software here depicts nice plain contact areas in purple. Occlusal interferences are depicted in red. Every software gives you the ability to add or remove something of your design or to smoothen it. Especially the smoothen tool is great to smooth the edges at the far back of your guard. Don't do this after printing. Feel free to individualize the guard according to your patient's individual needs. You could also over-exaggerate facets to guide the muscles of your patient more heavily. That's pretty much it regarding the design. Just export the STL file, nest it in your nesting software and then print it. Thank you for listening. Feel free to come back to see how nesting goes. Yours, Dr. Wally.